In this video, we will explore pulmonary hypertension in newborns, covering risk factors, pathophysiology, classification, clinical presentation, diagnosis, management, surgical interventions, associated conditions, long-term outcomes, and research advancements. Let's understand and improve patient outcomes in this fascinating field. Several factors contribute to the development of pulmonary hypertension in newborns. Maternal factors like gestational diabetes, preeclampsia, drug abuse, and certain infections or medications increase the risk. Neonatal factors such as prematurity, low birth weight, respiratory distress syndrome, and PPHN are important determinants. Genetic predisposition, particularly specific gene mutations, also play a role. Recognizing these risk factors is vital for early detection and intervention. Pulmonary hypertension in newborns is caused by several factors, including vascular remodeling and changes in pulmonary vascular resistance. This leads to narrowed vessels, increased resistance, and elevated pressure within the pulmonary circulation. Altered levels of vasodilators and vasoconstrictors also contribute. Pulmonary hypertension in newborns can be classified into different types and subtypes based on various criteria. The most widely used classification system is the Dana Point classification, which categorizes pulmonary hypertension into 5 groups: pulmonary arterial hypertension, PAH, pulmonary hypertension due to left heart disease, pulmonary hypertension due to lung diseases and/or hypoxia, chronic thromboembolic pulmonary hypertension, and miscellaneous causes. Each group encompasses specific etiologies and pathophysiological mechanisms, and accurate classification assists in tailoring treatment approaches. A newborn with pulmonary hypertension may present with several clinical manifestations. Cyanosis, or bluish discoloration of the skin and mucous membranes, is a hallmark sign of significant oxygenation impairment. Tachypnea, rapid breathing, is another common symptom resulting from increased respiratory effort. Poor feeding and failure to thrive may also be observed due to reduced oxygen supply and increased energy expenditure. Recognizing these clinical signs is crucial for early diagnosis and prompt intervention. Accurate diagnosis of pulmonary hypertension in newborns requires a comprehensive diagnostic approach. Imaging studies, such as chest X-rays and high-resolution computed tomography, HRCT, provide valuable information about lung architecture and potential lung diseases. Echocardiography is a key tool for assessing cardiac function, estimating pulmonary artery pressure, and detecting structural abnormalities. In certain cases, cardiac catheterization may be needed to confirm the diagnosis, measure pulmonary pressures more accurately, and assess response to vasodilator testing. A multimodal diagnostic approach ensures a thorough evaluation of the condition. Distinguishing pulmonary hypertension from other cardiopulmonary diseases can be challenging, as the clinical manifestations may overlap. Differential diagnoses include congenital heart defects, lung diseases, for example, bronchopulmonary dysplasia, upper airway obstruction, and other causes of cyanosis and respiratory distress. A detailed clinical evaluation, imaging studies, echocardiography, and cardiac catheterization can aid in ruling out alternative diagnoses and establishing an accurate diagnosis of pulmonary hypertension. Several prognostic factors have been identified in pulmonary hypertension in newborns, which can help predict poor outcomes and long-term complications. These factors include the severity of pulmonary hypertension, associated congenital heart defects or lung diseases, the response to therapy, the presence of genetic mutations, and the presence of significant comorbidities. Awareness of these prognostic factors aids in risk stratification, treatment planning, and long-term follow-up care. The management of pulmonary hypertension in newborns involves a multidisciplinary approach. Pharmacological interventions form the cornerstone of treatment and include the use of pulmonary vasodilators, for example, inhaled nitric oxide, prostacyclin analogs, and diuretics. Oxygen therapy is essential for correcting hypoxemia and optimizing oxygen delivery to tissues. In severe cases, mechanical ventilation may be required to support respiratory function. Additionally, optimizing nutrition, managing fluid balance, and addressing associated comorbidities are crucial components of comprehensive management. In selected cases, surgical interventions play a significant role in managing pulmonary hypertension in newborns. Atrial septostomy, a procedure that creates or enlarges an atrial communication, can alleviate right atrial hypertension and improve oxygenation. Lung transplantation may be considered in cases of severe and refractory pulmonary hypertension with a poor prognosis. The appropriate selection of candidates and timely execution of surgical interventions can greatly impact patient outcomes. Pulmonary hypertension in newborns often coexists with associated conditions, such as congenital heart defects and lung diseases. Understanding the impact of these conditions is crucial for comprehensive management. Congenital heart defects can further impair pulmonary blood flow and worsen the severity of pulmonary hypertension. Lung diseases, including bronchopulmonary dysplasia and respiratory distress syndrome, can contribute to the development or exacerbation of pulmonary hypertension. Adequate management of these associated conditions is imperative for optimal patient outcomes. Pulmonary hypertension in newborns can have long-term implications on neurodevelopment and respiratory function. Hypoxemia during critical periods of brain development may lead to cognitive and neurological deficits in later life. Chronic respiratory insufficiency, such as exercise intolerance and chronic hypoxemia, may persist even after successful treatment. Early identification, appropriate interventions, and long-term follow-up are essential to mitigate the long-term consequences of pulmonary hypertension in newborns. Ongoing research in the field of pulmonary hypertension in newborns is focused on developing novel therapies and targeted interventions to improve patient outcomes. These advancements include the exploration of new pharmacological agents, gene therapies, and endothelial dysfunction targeted treatments. Furthermore, efforts are being made to identify novel biomarkers for early diagnosis and prognostic stratification. These research endeavors hold promise for advancing our understanding and management of pulmonary hypertension in newborns. In conclusion, pulmonary hypertension in newborns is a complex condition with diverse causes, mechanisms, and treatments. Understanding its risk factors, diagnosis, management, and research advancements is crucial for improving outcomes and developing new therapies.